Lagos State health workers have commended the state government for giving them a listening ear by paying off their 3-month COVID-19 special allowance. However, the workers say that while the private staff among them have received their allowances in full, their government counterparts are yet to receive all their package. They say that the government paid 3 months out of the 4 months it was owing the government health workers. According to them, the private staff worked from January to March, while the government workers served from January to April, but were paid 3 months instead of 4 months. Joining us to discuss the development is one of the volunteer nurses in the state, Wasiu Akinwale. Good to have you on Newsday, Wasiu. So, for the viewers out there, just explain to us exactly the latest update on the payment of these allowances. First, from the the part of the for the government workers, and of course for private ones.
Okay. Thank you so much for the privilege given to me.
All right.
I'm Wasiu Akinwale, one of the COVID response team which worked from January to March 2021. I want to appreciate the Lagos State government for paying us our COVID allowances. However, the Lagos State government staff are still being paid for the last month, which is April. We heard the news from Harais that the governor said he's not owing any staff any COVID allowance up to May. So we just want to plead for the remaining COVID allowance to be paid for our government. Now we have this third wave. So they have done their best during the first, second, and third, and they are still willing to do. So please, we just want to plead so that they pay as soon as possible.
All right, so the last time we spoke about this, we spoke to one of your colleagues who was also a volunteer nurse, and he said basically that he's not sure if the state government was responsible or if it was the middle person that was in the middle that was responsible for holding back the funds that were due to them. I just want to gauge your thoughts regarding what you actually think is happening. Do you think the Lagos State government has paid and that someone in the middleman is probably holding money that actually due to you? What's your take and what are your thoughts?
According to the news, on the 6th of June 2021, so that when Governor Sanwo-Olu was interviewed, I heard him saying he is not owing anybody COVID allowance up to May. So we don't know the person. Maybe there is a middleman, or I believe our governor. I believe in him. We voted him. I know it's for the masses. It's for us. So I believe that it will do everything in support of us. So he has paid these COVID allowances according to what he said. So, but I don't know if there is a middleman or if there is a statistical error, or if there is anything. We want everything to be rectified as soon as possible.
So what would be your appeal? Sorry to have
Go ahead.
Yes. What would be your appeal to the Lagos State government now, as knowing the fact that they are watching at the moment? What would be your message to them?
I want to appeal to the Lagos State government to appreciate the government workers more. Actually work with government for a period of time and know how everything was. So I believe that the government of Lagos State is trying. So, and I know they can do more. So I know they can arrange their protocols, they can set up their strategies with the competent hands, so that the health workers will be motivated to work.
Talking about motivation, Wale, can you give us a sense of the risk you take at isolation centers when it comes to taking care of patients affected with COVID-19?
When we are taking care of COVID-19 patients, especially during the second wave, we have so many patients apart from COVID cases. We have some comorbidities like psychosis, that's mental illness. So like HBSS, like sickle cell patients, and we have so many like hepatitis. In fact, together with tuberculosis, HIV, we manage so many. So we were at risk of having so many, contacting so many infectious diseases apart from COVID-19. So apart from that, we were not provided with appropriate and adequate personal protective equipment. So, and apart from that, so we also face the risk of violence in hospital. You know, we said we have some mental ill patients. So that I was a victim of the psychotic patient who fought with me, torn my clothes, torn my PPE, just because I wanted to save her life.
But are the authorities, Lagos State government authorities, aware of those challenges you just mentioned now? And did they at one point do anything about it?
I think they should be aware, because we have our record. We have our record, which include the diagnosis of the patient, which is COVID-19, and the comorbidities.
But
so
I think it's one thing to have the record, and it's one thing for the Lagos State government to be aware. The records, are they being passed? Are they daily reports or weekly reports or monthly reports that go to?
I don't know if the records are reported, but I believe these are being handed over to appropriate authorities, which I think they should have sent to the Lagos State government.
All right, Wale, now you're coming to the media to stake your issues regarding the payment of the last few months, as it were. And of course, you also mentioned the issue of the third wave that is, practically on its way, and it's already there. So in that regard, have you gotten any response so far regarding your current issues with the state government?
Please, can you come back?
No, I'm talking about the last few months of the allowance.
Okay.
Have you gotten any response so far?
Yes. Yes, I really appreciate the Lagos State government. The Lagos State had paid us the 3 months we worked. That's
Yes.
January to...
So beyond the 3 months.
To March. So the government workers, the staffs, worked for 4 months. So they paid all of us 3 months. So on the other part, that is the Lagos State government workers. They are yet to receive their April COVID allowance. So, and they are now calling some of them back to come and work. To come and work for. Apart from that, in IDH, so we have so many conditions apart. As I've said earlier, there was a time we were managing HIV patients, tuberculosis, together with COVID-19. So this HIV and tuberculosis is the main condition they were treating before the onset of COVID-19 cases. So I believe that the hazard allowance for this HIV and tuberculosis, for people managing HIV and tuberculosis, is different from those people, those health workers that are being deployed to the facilities. So I still want to plead to motivate them in order to do more. We all risk our lives, and that's what we signed for, and we are ready to do more to save lives.
Okay, interesting, and kudos to you for the work that you're doing. But let's talk about the third wave, which you mentioned earlier on as well. I wanted to gauge your thoughts regarding this potential for the third wave, just going away from the financial aspects that we've been talking about earlier. Your thoughts regarding this third wave, and if you think a lockdown is imminent in Lagos again.
My thought about this third wave in Lagos State. I don't know how severe this is going to be, but I believe we should all use our personal protective equipment, appropriate use of our face masks, appropriate hand washing, in order to prevent lockdown, social distancing, and everything we should abstain from anything that could lead to transfer of the COVID-19 infection. The second wave was deadlier than the first wave. We don't know how third wave is going to be.
All right. In that regard, Akinwale Wasiu, volunteer nurse for the management of COVID-19, of course, in isolation centers in Lagos State. We'd like to thank you for coming to Newsday. Good to have you.
Thank you very much.